Finelli, first, congratulations.
Thank you.
You know, I noted in in our Rules Committee notes that you have identified obesity, diabetes, and mental health as key priorities for the department moving forward in the future. And as far as some of us are concerned, particularly with respect to type 1 diabetes, there's a significant need for further education efforts in the state due to incidences of misdiagnosis and the like, particularly with young children. And in the area of mental health, due to a fairly significant disparity in mental health funding, particularly under the 1991 realignment for mental health funding in various areas of the state, there's a need for, in my opinion, mental health funding parity. So given the priorities that you've identified for the department, particularly those with respect to diabetes and mental health, what are your plans?
So right now for mental health, we have a series of activities that we are doing. One is the California Reducing Disparities Project, and that program is around 5 different population areas and really working with community level folks on the ground to look at populations from Asian populations, African American, LGBTQ, and really looking at those populations and communities that have promising practices that may not have been able to qualify for big grant programs and things, but working with them because we think they have good ideas and learning from them and getting them the resources they need to conduct real evaluation, collect data, so that we can over time see what actually is working on the ground. And so we're in our second year of a 5-year set of pilot projects, and I think that we have an overall evaluation strategy so that everybody, regardless of the type of program that they're running, everybody will collect some standard data so that we can see what works and why it works. And I think that's a big effort that we're underway on the mental health side. Many of our programs in our maternal and child and adolescent health also address mental health services. So our home visiting program, part of what we're trying to do to improve the outcomes of mothers and babies is really to look at not just healthcare and access to healthcare, but those community linkages that can build resiliency in our population, and things like stress management and linkage to mental health services can really build that in our population. And so I think those are some of the things we're doing on mental health. We're also working with our stakeholders under the Let's Get Healthy California project, our state health improvement plan, and mental health comes up across the board with many of our stakeholders as an area where we want to work more closely together to address and hopefully have some collective impact around those issues. On diabetes, unfortunately, we don't receive a lot of money to deal with diabetes, but we have a program called Prevention Forward, where we are trying to make sure that we're working with our clinical partners and Medi-Cal and DHCS and to identify and diagnose diabetes much earlier, to educate people, because not only diabetes, but those with pre-diabetes, and trying to keep them from getting diabetes. So we have an awareness campaign, we have a website of information, and we're working, partnering with healthcare to make sure that we can move that forward.